With each new season comes new bugs and potentially infectious diseases. Now, most bug bites and stings are mild and cause not much more than itching and discomfort, but there is always a chance for more serious infections and allergic reactions. But do you know what signs to look out for when more serious infections occur? We had a chance to speak with Dr. Candida Suffridge of Baylor Scott & White Healthcare in Georgetown, Texas. She goes over how to prevent bug bites and what to look out for when a more serious allergic reaction occurs.
Generally, insect bites are not serious and they're what we call self-limited. So people can take an antihistamine to kind of help with the itching, maybe use a topical cream. However, if a patient has any symptoms other than the local injury, they should definitely present to their doctor. Those symptoms could be a fever, it could be a spreading rash.
Some other symptoms to look out for are swelling of the lips, eyelids, or throat, dizziness, faintness or confusion, and rapid heartbeat. If these signs are visible, seek medical care right away. If it's possible, take the bug or insect with you if you don't know what it is, so doctors can better understand how to treat you. Dr. Suffridge says that for children and older adults, because their immune system is usually weaker, it's important to keep a closer eye on them.
I think in general, diseases are more serious in young children, so less than 5 years old, and older individuals over 65. It's really a matter of how healthy their immune system is. So certainly young children are still developing that immune system. And there are some immunosuppressive medications and other drugs that can affect their immune system. Also, as you age, your immune system isn't quite as healthy as it used to be.
Of course, the first step to prevent an infection or virus is to prevent a bug bite or sting in the first place.
It's really important to, in general, stay away from areas that have a lot of insects, but if you're going to be around those areas, keep your skin covered with some light clothing, and then certainly wear insect repellent. So we know that mosquitoes breed and live in stagnant water, so it's very important that you don't keep standing water around the house.
Some other tips to keep bugs away and off of you include staying indoors at dawn and dusk, when flying insects are most likely to hit. And to avoid stings from honeybees, wasps, and yellow jackets, avoid bright colors and floral patterns.
I think what's most important is you remember that you can get an infection from any kind of an insect bite.
Bug bites are going to happen, so when they do, just be aware of your symptoms. And if the young or elderly get bit or stung, watch them a little more closely just to be sure they're okay. Remember to wear loose-fitting clothing when in areas where bugs could be, use insect repellent, and reapply it if you perspire or decide to get in the water. If you do have or notice any symptoms, seek medical care right away. For Daily RX News, I'm Gabe Garza.